Breast concerns come in many forms and are way more common than most people realize. I'm talking about everything from small breasts to overly large breasts to nipple issues, sagging breast, stretch marks, asymmetry, volume loss over time. All of these can be addressed with the correct treatment plan. I'm Dr. Tiffany McCormack from Reno, Tahoe Plastic Surgery, a world's leading clinic. Today I'm going to talk to you about some of the most common concerns regarding the breast and what we can do to address them. So what are some of the most common concerns regarding the breast? The first that comes to mind would be small breast or underdeveloped breasts, or even breasts that have lost their volume from things like pregnancy or weight loss over time. Asymmetry is another common concern that I hear about every day in my practice. Some patients are concerned about large breasts, overly large breasts, and sometimes sagging breasts, and breasts that are large and sagging at the same time. Another concern that I see with breasts is sagging breasts or stretched out skin. And again, that can happen after pregnancy or after weight loss or just changes with age or even genetics. Nipple concerns are another issue. Some people come in with hypertrophic or overly large or projected nipples. Some people come in with inverted nipples, both of which can be corrected with plastic surgery. Another concern that I see is tubular breasts. Tubular breasts are shaped differently from a round, full breast. Often there's a constricted base, and sometimes some breast tissue is herniated into the areola, which can make it look puffy. A lot of these concerns regarding breasts are more common than you think. I see them all the time. In fact, during consultation, when we talk about breast augmentation, 9 out of 10 of my patients are asymmetric. And all of them will ask me, is this something that's normal? Do you see this, or is this just me? And I tell them, I assure them all the time, this is very normal and very common. And usually we can correct this with either different size implants or adding a little bit of volume with fat, or maybe reducing the other side to match the smaller side. Asymmetry is another really common issue with patients. A lot of my patients come in and they say, I'm asymmetric, is this abnormal? Is this something that you see? And I tell them that 9 out of 10 of my patients often have some element of asymmetry. What are the major contributing factors to breast concerns? There are a few. One would be weight loss. One would be pregnancy, or even weight loss following pregnancy. Sometimes genetics play a role. Hormone changes can play a role, just aging, or even post-trauma or some kind of previous surgery on the breast can lead to some of these concerns. Let's go through some of the ways that these concerns can be treated. If you're experiencing a loss of volume or small breasts, I'll often recommend breast augmentation. That can be performed with either implants or fat or both. If you have sagging breasts or stretched out skin, I usually will recommend a breast lift, with or without augmentation, and that can be done with an implant or with fat or with both. If you're experiencing sagging or stretched out skin on your breast, then I will typically recommend a breast lift or a mastopexy. Sometimes we recommend adding volume at the same time. If you have overly large breasts that may be causing you symptoms such as back pain and neck pain and difficulty wearing clothes or doing exercise, I'll often recommend a breast reduction. The nice thing about a reduction is it also involves a breast lift at the same time. If you experience asymmetry on the breast, this can often be corrected by either adding or subtracting volume from one side to the other. We'll maybe add volume with either fat or an implant, or maybe different size implants or different amounts of fat from one side to the other. In some patients, we'll do a reduction on one side or just do a lift on one side. So a customized approach is what's really important to achieve a nice, symmetric, even result. If you have tubular or constricted breasts, first of all, it's pretty common, probably more common than you think. Secondly, it's a big topic all on its own. This can be corrected but may require different types of surgery to achieve the goal that you're looking for. Whatever your concern may be regarding your breast, you're not alone. These things are very common and often very treatable. For more information, visit worldsleadingclinics.com.